Welcome to The Explainer. Today, we're going to talk about something that touches millions of lives but is still so misunderstood: depression. We'll break down what it is, where it comes from, and, maybe the most important part, how people recover. It's all based on what the experts are telling us, so let's just dive right in. Okay, so this is a really important question, right? We've all felt sad. We all have those days where we're just down. But when does that normal sadness cross a line and become an illness, something that really takes over your life? Where is that line exactly?
And to get a sense of just how common this is, check out this number. Experts think that a whopping 60 to 70% of the world's population has gone through depression at some point. Think about that. This isn't some rare thing happening to a few people. It's a huge part of the human experience.
So what is clinical depression? Well, officially, it's a mood disorder, and it's so much more than just feeling sad. It's this deep, persistent feeling of sadness and, maybe even more importantly, a total loss of interest in things you used to love. It really gets in there and affects how you feel, think, and even how you act.
Yeah, it's not just about feeling blue. It really impacts your thoughts, your body, your whole life. So let's get into the specifics. What are the signs we should be looking for?
Okay, so the symptoms can be all over the place. Of course, there's that constant sadness, but there's also just losing interest in everything. You might see big changes in sleep or how much someone eats. And then there's this bone-deep fatigue, Plus, these really heavy feelings of worthlessness or guilt.
And it can get even more serious. It can become almost impossible to focus on anything or even make a simple decision. A lot of people also get physical pain that doesn't seem to have a cause, like headaches that just won't go away. And at its most severe, it can lead to recurrent thoughts about death or suicide.
So here's a key question. Does it look the same for everybody? And the answer is a definite no. The way depression shows up can be totally different depending on your age, and that's exactly why it so often gets missed, especially in kids and in older folks.
Take kids and teens, for example. You might not see sadness at all. What you might see is them being irritable all the time, or anxious, or maybe they just pull away from their friends. It's so easy to just write it off as, teen angst. But this is different. It's something that sticks around.
And then on the other end of the spectrum with older adults, it's also really tricky. Things like being tired all the time, or not wanting to eat, or having trouble sleeping. That can sound like a lot of other health problems, or just, getting older. They might not even say they're sad. They might just talk about feeling bored or helpless.
Okay, so let's get to a really crucial part of this. What causes it? Because this is where a lot of the misunderstanding comes in. Let's look at what's really going on.
And we need to be crystal clear about this. Depression is a medical illness. It is not a character flaw. It's not a sign of weakness, and you can't just snap out of it. Seriously, it's a real illness just like diabetes or heart disease.
And it's never just one single thing that causes it. It's usually a mix of things. We're talking about brain chemistry, the balance of chemicals in your brain. Genetics plays a big role too. If it runs in your family, your risk is higher. And then there are stressful life events, things like trauma or a big loss or even dealing with another medical condition.
Okay, but here's the good news, and this is probably the most important thing we're going to talk about today. Depression is treatable. Recovery is absolutely possible. It's not just some faint hope. It's a reality for most people who get help. So how does recovery work? Well, the most effective treatments are pretty well known. It usually starts with psychotherapy or talk therapy. For some people, medication can be a huge help. And then you have lifestyle changes, things like yoga, meditation, exercise, that can make a really big difference too.
And you know what the experts all say? Getting help early is key. One expert put it really well. If it's detected early, say in the first 6 months, we can treat it very, very effectively. It makes all the difference.
So that leads to a big question, doesn't it? If treatment works, why don't more people get help? Well, there's this huge barrier that we really need to talk about.
Just acknowledging you need help can be the hardest step of all. And there's a really powerful reason for that, especially in places like Vietnam, where mental health isn't something you just talk about.
It really comes down to this: the fear of being labeled, that social stigma. People are afraid of being seen as tâm thần or mentally ill, and that word carries so much weight. It can bring shame to the person and their whole family, and that fear just forces people to stay quiet. But look at this data from the World Health Organization. It kind of puts everything into perspective, doesn't it?
In 2023, depression was the third biggest cause of disability on the entire planet, and it's on track to be number 1 by 2030. This just proves it's a common condition, a global health crisis. It is not a personal failing.
So, what's the big takeaway here? It's this. Seeking help is a sign of strength. It really is. It's an act of courage. It's you taking control and choosing to get better.
So we'll leave you with this final thought, a question to really think about. What's one thing you'll do today to take care of your mental health? It could be for you or for someone you care about, because that first small step, that's where everything starts.
Health is the most precious gift. If this video helped you or someone you love, please like, subscribe, and share so more families can stay safe and healthy.